Late Night Health continues with Dr. Paul Corona. I'm Mark Alyn. We're talking about the D word. We're talking about why is it the D word? Why don't people want to use the word depression? Everybody seems to be afraid of it. Everybody seems to have it at one point or another. And what can people do about it? Well, we've talked about what people can do. Exercise. They can do meditation and yoga. But there are drugs that can help with depression, Dr. Corona. And I want to know, if I come down and you say, Mark, you are depressed, I think this will help. Is that a happy pill you're giving me?
But the misconception, the biggest problem is stigma, but the other problem is misconception about medications. It's not a false, fake happiness we create with psychotropic medications. What we're actually doing is rebalancing the nervous system. And so what they actually do is they bind to the nerve cells and they fix leaks on the cells, so they reestablish normal connection of the chemicals in the system. So that's why people say, I feel like the old me back. I feel like myself again. Or, I don't know if I felt this good. I don't think I've ever felt this good. Maybe when I was a kid, but I don't remember that far back. So that's what I'm looking for, that creating that holistic happiness, that healthy balance in the system.
But almost everybody suffers depression at one point or another. It could, usually it's mild. Am I correct?
Correct. Usually it's mild.
And then sometimes it gets worse, or it continues. And
right.
So you might need a little push. So question one is, if you prescribe a drug and you say, Mark, you are depressed, I think this will help, and you give me XYZ drug, do I have to stay on that forever? Or is it, let's try it for a month or two, and let's see how you react. And then we'll reevaluate how you feel. Maybe we'll take you off of it at that time. How does that work?
Exactly. When I take a very complete history, and then I try to choose the best first choice that I can based on the person's history and patterns. And then what I do is, I don't wait a month to do it. I give it to them, samples usually at the office, and then I have them call me in a week. I don't wait a month. They call me in a week and let me know how they're doing, and then I might adjust it before they see me the next week or the next month. And then we basically, it's a pattern. We check it. The key is the communication. If I communicate with patients like I love to do, they tell me, and we listen to each other, and that's how it works.
The idea of the mind and body, according to Chuck Smith, the way that this guy Paul Corona has put together in these books, Healing the Mind and Body, is that you care about both, where many doctors ignore the mind, and that your whole practice is based on that one-on-one communication with the patient to the doctor. I can say anything I want to Paul Corona when I'm in that session, so that I can start that healing process.
Right, and it's not a question, is it the mind or the body? The mind is the body. Or what I say is that it's not the chicken or the egg, it's the chicken and the egg. The body is the mind. The nervous system, which is the brain, goes everywhere in the body. So when the body hurts, the brain doesn't, the mind doesn't feel good. When the mind is not doing well, the body doesn't feel good. And so there's this interplay between the mind and body that people try to separate. They say, is it a mental problem or is it a real problem? So what does that mean? I say, what do you mean by mental? Don't you mean your brain? Well, yeah. Well, isn't that a vital organ? Well, sure. So when we say mental, we mean, is it a fake problem I'm making up, or is it a real physical problem? And that's the mind-body connection that people get confused with all the time. And I try to clear up the fact that you can't separate the two.
The mind obviously controls the body. So if the mind doesn't feel well, if the mind isn't at optimum working capacity, the body's not going to work at optimum working capacity either.
And then when the body's not working at optimum capacity, then that causes stress, and then the stress causes more pain and more dysfunction. And so there's interplay between the two, that when one gets worse, the other gets worse. And then they play, and it's a vicious cycle that keeps going.
And it gets worse and worse and worse.
It gets worse as if it's not treated. And again, separating out situational, it depends on the chronicity of it and how long it's going on and the pattern, whether we decide whether we're going to treat it with medication or hold off on that.
Gotcha. Another fascinating time together. Dr. Paul D. Corona, Healing the Mind and Body. We will have in the next couple of weeks some videos up with Dr. Paul on Late Night Health. There'll be combinations of some new videos we have in the works, as well as just our conversations together. Dr. Corona, thank you very much for joining us. I appreciate that, and I thank you for tuning in. This is Hour 1 of Late Night Health. If you don't get Hour 2, you can always go to latenighthealth.com. I'm Mark Alyn. See you around the other side.